Well, good morning. I am all about health this morning and, of course, appreciating the men in the society. I know, right? The WCW edition. Celebrating men. Anki, what are you doing? Yes, exactly this. And I have on set a gentleman and a lady. How good can this set look? I am absolutely excited about young people who are becoming helpful to society by making things easier, especially in accessing quality health care. What else do we need? Minds like this. And I will not say too much. I will just say there's a digital platform for you and I to finally make our health better. I will not say much, like I said. You guys look amazing.
Thank you very much.
I didn't get the memo. I should have looked better. I will allow you guys to introduce yourselves, connect with the viewer at that personal level before we break their brains.
Okay.
Yes.
Hello viewers, my name is George Mwangi Gichuru. I work with Sahl Health in the Department of Partnership Leads, and I'm happy to be here. Thank you for having me.
Thank you so much. Are you partnering with me?
Yes, we can.
Yeah. Kelly.
Hello guys, my name is Kelly Kinuthia. I am a corporate manager at Sahl Health and I'm excited to be here.
That's really nice. And I like that you've balanced my table.
Yeah.
You know, every time I yap around here and I say, this is a gender sport, and guys are like, no, we're only seeing a man. I say, it's a gender sport. They say, oh, it's only a woman. But today, you have covered me. About Sahl, the digital platform. I know there's something you're launching, but let's talk about Sahl first. It's not an abbreviation of anything.
No, it's not.
It's a complete name.
Yes, it is. So Sahl Health, it's more of an Arabic name, which means convenience and affordability. So even as we continue discussing, you'll realize that most of our products are on the convenience side and affordability. So that is just the meaning of the name. Yes.
Wow, we learned a new word, viewer. Good morning. So I'll meet you at Sahl. Is that appropriate when it's convenient?
I don't think
so. Oh God,
no.
That's my blonde moment. All right, so the minds behind this, I'm very curious. What was the inspiration behind Sahl? Yeah, Kelly, you want to take that?
Okay. Yes, so health in itself is sometimes something that comes across as really expensive. Most of the times you see people having to ask for donations. Maybe you put in a group where you have to seek for medical appeals. Let's contribute to so and so that they can be able to access healthcare. So the main inspiration behind Sahl Health is actually to make healthcare affordable and accessible. And not only healthcare, but quality healthcare to become accessible and affordable to everyone. Yes.
I like that, because I know with COVID-19, our finances have become hell. It's been very, very difficult for most people. And most people don't even want to go to the hospital physically anymore. Yes, they're either full or just, you know, everyone's scared of catching COVID-19 for some reason. So Sahl, you know, a lot of people are asking, is this an application? Is that a way we get it on the phone? Is it a code? What is the platform, really?
So basically, we are more of a website platform for now, but we are working to become an app maybe in the near future. And once you access the website, you are able to see what we do more, our services, our products, and how we partner with healthcare institutions. As you have said, it's true, many people, especially in 2020, they have not been going to hospitals. Many have been doing self-medication, self-diagnosis, and it has been a concern to healthcare facilities. And us as Sahl Health now, as an online platform, we are here now to link you. Instead of you doing the self-diagnosis and such, we are now here to link you with a healthcare provider. So we are more of a website for now, but we are working to become an app very soon. Yes.
So you actually link us to the health practitioners?
Yes, yes.
So which is this website? As we talk, they need to check it.
Yeah.
You can give us the website.
Yes. So you can type in www.sahlhealth.com. Yes, so you'll be able to see all our products, because we revolve around 3 key products, which is membership. We also have a health blog, and now on 19th of June, we'll be launching a health e-commerce site.
I really like the part of the health blog.
Yes.
So then you also do offer a lot of health information.
Yes.
Yeah, very
Come
many.
on.
Yes. Actually, if you check on our blog, we have over 2,500 different diseases. Some maybe you have never heard of them, so that is part of our blog. We have hundreds of articles on health-related issues and so much more, so that is also part of our website. Yeah.
Because then when I Google headache on Google, then they'll just say I have a brain tumor. I'm not saying Google is crazy. I'm just saying sometimes there's so much information out there for all of us. We can easily get the wrong diagnosis, go get, stuff over the counter and treat the wrong thing.
Yeah, very true.
Yeah, so that's really, really important. Now, I've been asking myself this question. I know this is good for all of us, but I know as a Kenyan living in Kenya, how skeptical we can all be about who are these people and who are they linking us to. Kenyans are very skeptical. Have you guys thought about maybe certain cultural factors or beliefs that would make us reject Sahl? And how are you guys creating awareness about it?
Okay. So in terms of cultural barriers,
Yes.
We are living in a present world where everything is now taking and revolving and actually evolving into the digital space. Nowadays, if you want to buy something, you'll just go online and buy it. If you want to book something, you'll just go online and book it.
Okay.
And so we thought, why not health? Because you realize that health forms a very integral part in every human being. And so we thought that, yeah, we might have people who have certain beliefs, but then again, that does not mean that we should stop at that. It means that we should work to gain their trust, that we should work to show them, this is different. You can actually access healthcare even at the comfort of your home. Yes.
I like that. I like that we're positive about it. We're not stopping at that. George, I want to challenge you in that same light.
Okay.
Excuse me, in that same light, I know that there are people watching, probably on their small TV screens or on their phones, that old woman, that somebody in Turkana. Not everyone in the grassroots really get to know what a website is. How you guys capacity, how you building capacity over there, where there is no urban settlement or digital or technological awareness, because I think this is for all, right?
Yeah.
How you guys battling the inclusivity idea for the people in the rural settlements and urban areas?
That's an interesting question, but maybe just to share briefly.
Yes.
Right now, most of our operations are in Nairobi
Okay,
area,
all right.
Nairobi metropolitan area. And we are now looking at reaching out to more people.
Okay.
So it's a challenge you have shared. Maybe we can look at how we can be able to reach out to those people. But for now, our operation is around Nairobi metropolitan area.
Okay.
Yes.
But however, what we're talking about is if I have, my water has broken, women understand, and the baby is coming. I just reach you guys on the website? Or what are these services I can get real quick? Are there services that are on in the process of being incorporated? What are the main or the services that we can, as early as this morning, somebody watching can actually get from the website?
Okay, so when you register as a member, you are able to access health support services. So the way you're saying that if your water broke, for example, that means you can be able to get an ambulance to come and get you from where you are and take you to the nearest health facility. So our mode of partnership basically extends from hospitals, pharmacies, health support services, emergency services, as well as laboratories and imaging and diagnostic centers. Not forgetting to mention dental centers and optical centers. So when we talk about health, we are looking at every health provider. It could be a psychologist. From our platform, you can be able to reach a psychologist as well. Yes.
Wow. I can reach a psychologist,
Yes.
a counselor.
Yes.
It's a men's health month, and
yeah.
most of you guys, George, don't like to come out physically. So if you're watching, you're covered. George here is like, yeah, just reach them and get. Why are you laughing? And get a psychologist, right?
Okay.
That's a lot of services.
Yeah,
How is
true.
it expensive? Before you're a member,
It's not expensive.
I'm sure when you're a member, there's a discount, right?
Yes,
But
there
before
is.
membership.
Before membership, you will get the services at the normal pricing.
Okay.
So You go, you look for the services, you get it at the normal pricing according to how the facility will charge. But now the discount comes when you are able to become a member. So that is when you can be able to get these services at very good discounts from all these service providers. Yes.
So membership everywhere, even in clubs.
Yeah.
You guys are not good people. You're laughing about club memberships. Now, I know there's a launch coming up. What we are launching is the e-commerce platform.
Yes.
Is it?
Yes.
How is this important for the Sahl
So.
health? Yeah.
Okay, so on 19th June
Yes.
2021, we are launching a health e-commerce site. It's the first ever of its nature in Kenya. So it will be basically a site where you can buy medical tests, and also you're able to choose where you want to go, in terms of which facility you want to go and at what time you want to go. Yes, because again, we are looking at convenience. We want to make it convenient as much as possible for the user. So on 19th, we'll be launching at Two Rivers Mall at the CK Square from 9 a.m. to 1 p.m.
1 p.m.
Yes, so we look forward to people embracing the product. It's really a nice product. We have pulled all strings to ensure that it's user-friendly, and as well as you will be able to access all services, all health services from the site. Yes.
Underline, bold, italics, all services. George, a lot of people are probably reaching out and they're asking, so are we invited to the launch? Or who is invited? Because some people like to see it, see to believe.
Yes.
Yeah.
So everyone is invited on 19th.
Okay.
And you can come as many as you are, because
social distance, no?
There'll be it's a big space, a big venue for everyone can fit in. So you're very much welcomed. And this service, you'll be able to experience how we work, how the e-commerce works, and you'll be able to interact with some of our partners, hospitals, and partner doctors. So you can also get an opportunity to get some of these services at a very affordable price.
Nice. So we're actually getting the services as well.
Yes.
When we come for the launch.
Yes.
How about that, guys? Do something about this. Use this information, mark the dates, prepare that diary, that reminder, because I'm going to be there. If you also want to know how my health is doing, let's talk about this over the launch at the Two Rivers Mall, right here with the Sahl Health. Guys, a lot of people are talking about the universal health care and trying to achieve, and of course, health is very paramount. As the youth in the country, I know I want to close this. This could come from either of you. How are we doing in the health sector? Is this one of the things that prompted you to, decide to be the solution rather than the complaining tongue? Both of you can answer it as well.
Okay.
Yeah, well, okay. In terms of universal health coverage, you realize that the main aim is to ensure that people access preventive health care. That's the main aim. And so for us, we ensure that our products revolve around preventive health care. Okay. If it's membership, then that means you're able to access medical services at an affordable price. Okay. If it's health information, then that means you're able to read through our blog and you're able to know what am I supposed to do in case of this? How can I prevent this? If it's in terms of prevention of diseases, then we have the health e-commerce site. That means you can take tests early have early diagnosis to prevent maybe to prevent a disease that will come later on. So that means we are playing a part, especially in preventive healthcare. Yes.
Well, I like the preventive idea. So I'm thinking, well, I know there's the website, but then how do I reach you guys on other social media platforms? How do we piga kelele via Twitter and Facebook? George, you would want to take over on that?
So you can reach us on Twitter, Facebook, Instagram, and LinkedIn at Sahl Health. And Sahl, it's S-A-H-L and then health. So we are in all social media. You can reach us. And we are here to just have a discussion on preventive health care and so much on savings on your medical bills. Yeah.
Savings on your medical bills. Who doesn't want that? Have you guys partnered with La Paire Glasses?
Not yet, but now you will share the contacts.
Lapere, I'm actually already, and of course I'm using the promo code Ojwang Mariam even when I'm doing this to make sure there's a partnership so that people can reach you guys and of course use that particular promo code to get their glasses, you know, on discount, right? And the wear should actually be pimped up courtesy of you guys. So think of that partnership. Who knows?
Yeah, sure.
You should have seen their reactions. Kelly's like, huh. And George is like, yeah. So guys, thank you so much for coming. I'm proud of you guys being the youth and the voice and of course being the solution. Come again. And I think I'll come to the lounge.
You're very welcome.
And that's it, guys. Please do follow Sahl Health and get your health care, you know, taken care of. It's your responsibility. The platform is there, but what are you doing with the information? What you do with this information given right here is totally up to you. Enjoy your morning, and we'll be right back with another important discussion. Good morning.